As a former hospital patient safety officer and performance improvement executive, I am beyond excited about this novel product for protecting patients from the dirty stethoscope. Healthcare-acquired infections are costly events, both to the bottom line and to patient lives. Healthcare teams work to save lives every day in multiple settings. All too frequently, teams are devastated to learn their patients became sick or even died from preventable infections acquired while under their care. Healthcare systems spend much time and money educating staff on infection control, measuring rates of compliance with best practices, and using multiple well-designed products to safeguard patient care. And of course, we all know hand washing and gloving are mainstays for preventing cross-contamination, just as is the practice of ensuring environmental cleaning to prevent us from transferring infectious contaminants to our patients. The point of caring is doing our best to do no harm. Yet it happens, and infections are one of those harms that are less transparent while providing care, even among the most meticulous of providers. Why? Despite the abundance of studies showing the need for cleaning of frequently touched items such as cell phones, keyboards, etc., to prevent cross-contamination that could be potentially lethal to immunocompromised patients, it is very difficult to ensure compliance. The stethoscope is one such item, and an essential element to any practitioner's assessment of their patient status. As a provider, I know that it is important to clean the stethoscope before using it on a patient, just as hand washing is essential. Yet, as a professional who has measured healthcare quality, I found it is not always a common practice, especially when busy providers are seeing multiple patients in a fast-paced environment, and often to apply life-saving measures. Why? Certainly not for a lack of knowledge, education, or concern for the patient, but because humans can and will make errors when thinking about and/or discussing other important patient care issues. An example, while pondering multiple diagnoses and patient signs and symptoms, one could answer a question from a patient and, without realizing it, forget to clean their stethoscope. We all need easy reminders in a standard fashion to help us all ensure quality care processes occur. Much has been learned about best practices and how to employ them. Those practices that are truly best are those that can be readily and easily applied by multiple healthcare personnel in a standard pattern and within the environment of practice. Technology which can easily and readily eliminate the hazards of human error are most helpful. Indeed, the quality improvement techniques which have proven most effective are those that provide the easiest way to do the right thing each and every time. Just as having hand sanitizer and gloves immediately visible and available at the entrance to every patient care room, a stethoscope barrier dispenser in the same location would enhance the frequency of use and hence the infrequency of contamination with current multi-drug resistant and potentially lethal organisms. Thank you. I'm Cynthia Cadwell, nurse practitioner, CNS, and certified professional in healthcare quality.